Hi, I'm Esme with Hotwire Your Life, Mojo for Boomer Chicks. If you read my latest post, you might have noticed that lately I'm fascinated with plastic surgery. So on a recent trip to the East Coast, I decided to catch up with a good friend of mine who happens to be an amazing plastic surgeon. Trust me, I know. I've seen his work on a couple of friends of mine and you cannot tell. He's good. He's got an office in New York City as well as in Toronto, and his name is Dr. Trevor Bourne. Now, I don't know about you, but when my mother was about my age, plastic surgery really wasn't something that she and her friends discussed, much less do something about. So I asked Dr. Bourne, what is the main motivator for boomer chicks to go out and get plastic surgery?
There's multiple reasons. Probably the biggest one is competition in the workplace. But the boomers also don't like to age.
Come on, who hasn't seen that overly obvious, oh my god, look at that poor lady's face, wind-tunnel effect facelift, you know the one I'm talking about? Kind of gives plastic surgery a bad name, doesn't it? Dr. Bourne, do you find that this wind-tunnel effect scares women off? Is it a deterrent?
Certainly there's a stigma associated with work that's done that's very obvious and it doesn't look good, it's not natural, it's not aesthetically pleasing, and I think we can all tell what that looks like. I think today it's much more acceptable for people to have some changes done, whether they're minor, having a little bit of Botox or involving some fillers or even having surgery. People want to look as good as they feel.
What if you're a die-hard au naturel kind of gal who thinks Botox is for the birds, and one day you look in the mirror and you say to yourself, forget about these wrinkles, I'm going to make like a bird and go out and get myself a facelift? Well, is it too late? I mean, is it better to start younger with smaller procedures when it comes to plastic surgery?
It doesn't matter when you start, as long as it's reaching the goal that you want. Certainly someone that starts Botox and fillers early and has them done nicely and does the non-surgical procedures associated with it, like thermage, they will look good for a long time and may not need a bigger procedure for a long time. But certainly it's not necessary.
Dr. Bourne, what is the one most rejuvenating procedure a woman can have? What can give her boomer chick the biggest bang for her buck?
The most effective procedure? It's a good question. I think it depends on the area of the body you're starting on. Eyelid surgery is typically not as aesthetically done well as other procedures. So eyelid surgery is really one of the key areas where eyelid surgery is done really well, then the person's going to look fantastic. You can have other procedures done that may give you reasonable results, but not as the big wow.